Good evening, senators and members of the committee. Hopefully you can hear me. My name is Sue D'Amico, and I am the Chief Nursing Officer of Johnson Memorial Hospital in Stafford Springs, Connecticut, and also the Chief Nursing Officer of Mercy Medical Center, which is in Massachusetts, Springfield, Mass. I'm here to testify in opposition to Senate Bill 1067, an act concerning adequate and safe healthcare staffing. I'm a resident of North Haven, Connecticut, and I've been a nurse for 32 years, many of those years as a critical care nurse at the bedside. I have great concern for the proposed law that would mandate rigid nurse staffing ratios at every hospital in Connecticut. You've heard a lot of those reasons tonight, and I really don't want to repeat a lot of those reasons. I will tell you, at Johnson Memorial Hospital, which is a small community hospital, we have about 280 colleagues, a vacancy rate of 23%, 82 unfilled positions, 36 of them for nurses. We have done everything we can to try to fill these positions, including sign-on bonuses, shift bonuses, anything that we can do to recruit, scheduling, flexibility. It's very, very difficult. I also know as a nurse who's worked again for more than 32 years that making decisions regarding patient care should be made at the bedside. We've heard a lot about that today, that staffing decisions really are based on acuity and the knowledge of the people making the decisions. What I really want you to hear from me is that having responsibility for nursing care at Johnson and also at Mercy Medical Center in Springfield is unique, gives me a unique perspective, because at Mercy Medical Center, we have staffing ratios in our critical care units. I have seen firsthand the impact that these mandated ratios have had on access to care. I have been in the position of closing beds in our ICU because we have not been able to care for the sick patients who come into our emergency room. Somebody said here earlier that hospitals won't close beds. We do. We have in our critical care unit. We've had critical care patients stay in our emergency room overnight, or have had to send them out to different hospitals because we could not bring them up to our critical care unit because we did not have the staffed beds to do so. This is putting patients at harm. So I have a direct knowledge of closing beds, of keeping people in our emergency rooms who will be overcrowding our emergency rooms when we do this. We routinely, in Massachusetts, look to transfer critically ill, unstable patients to other hospitals instead of bringing them to the safest place they can be, which is within our walls in our critical care unit. Mandated nurse staffing ratios will have the same impact in Connecticut. I am living this in Massachusetts. So I ask that you not take away the professional judgment of nurses and reject this proposal. And I will take any questions.
Thank you, Ms. D'Amico, for your testimony. I just was quite impressed that you are a chief nursing officer for not one but two hospitals. We may have to have a bill that we'll have to have ratios for the hospital with a chief nursing officer. That'll be next year. We appreciate your testimony, and thank you for the work that you do. We have a question or a comment from Representative Dauphiny.
Thank you, Mr. Chair, and thank you for your testimony. I just wondered, when did the mandatory ratios go in the hospital in Massachusetts?
I believe it was 2018.
2018, and have you seen an improvement in the shortage of nursing there since then?
No, not at all. In fact, we all know what happened in 2019 and 2020. So the nursing shortage has not gotten any better. Their staffing ratios don't help the nursing shortage. The only thing that will help it is the things that we've talked about this evening, right? Increasing that pipeline, recruitment, retention, providing a real resiliency care for our nurses so that they really feel empowered on the job and are taken care of. Those are the things that work. A rigid staffing ratio that's mandated. It takes the really the decision-making away from the people who should be doing it. I partner with every nurse who've testified tonight because I think that it's those nurses and those of us who manage the health care that they provide who should be making the decision and putting the patient right in the center of those decisions.
Thank you for your testimony. Thank you, Mr. Chair.
Thank you, Senator Marks.
Thank you, Chair. Thank you for your testimony. So I just do question, though, that if you have to send a patient out because of the nurse staffing ratio, and you're saying, that that's dangerous for the patient, but yet putting the patient on a floor where they don't have enough nurses to care for them is just as dangerous. And I know nurses don't always put their oxygen mask on first. We never do. But it's also bad for the nurses if day after day after day they have inadequate staffing. So truly is taking that patient that might have to be transferred to another hospital that has enough nurses to take care of them, they have a low census, isn't that better for the patient?
So I have two things I will say about that. One is when we don't have enough beds, pretty much everybody else doesn't have the staff beds. We're all in the same predicament. So what we have is possibly an intubated patient on several vasoactive drips being driven around the city of Springfield looking for a hospital to land. I don't want that happening to my mother or my father or my loved ones. And I don't believe that the emergency room is a place to keep a patient like that all night. Secondly, staffing ratios in Massachusetts talk about location, not acuity. So we could have a couple of patients in our ICU that are really either step down or on medical surgical level of care, but we have not the room to move them to. So we cannot move the patient up to that critical care unit, even though the nurse can probably really care for that patient based on the acuity. It's location, not acuity, and that's what we're asking for us, those of us who understand the acuities, to make these decisions.
Okay, I doubt that they're driving around while they're looking for a bed. I mean, I hope that first you find the bed and then you take them. Is there anything positive you could say about the staffing ratio in the ICU?
It's very difficult for me to find something positive about it. I think what happens is that the conversations get more difficult between the staff and those of us trying to manage them.
Do you think your staff might have positive things to say?
I won't speak for the staff, but I know that we've partnered with the staff quite a bit around the staffing ratios. I believe that they have varying degrees of opinions about it.
Thank you. I appreciate your testimony tonight. Thank you.
Thank you so much, Representative Nicole Dietra.
Thank you, Mr. Chair. Sorry. Thank you for your testimony tonight. I didn't see it online. I want to make sure that you submitted it, and if you didn't, if you could do it for us, please. Thank you, Mr. Chair.
Thank you. Seeing no other comments or questions, we appreciate your testimony. And the next person